I'm Dr. Seth Woolstenhulme. I'm a board-certified functional neurologist, and I'm the owner of Activate Brain Clinic and Chiropractic. When a patient comes in with a concussion, what we're going to do is run through a bunch of neurological assessments. We check all of these things because everything has to work precisely and perfectly for a human body and a system to work like it's designed to. So after a head injury, they get their headaches, they get their sluggishness, they get dizziness. The brain it can't function properly. Things become slower. They start to miss things. They'll miss aspects of work. They'll forget dates and times. That they won't be able to execute what they need to as they're maybe working through their yard or cooking dinner. So they're not big things. They're not just all of a sudden like falling over, having seizures, but you start to miss these day-to-day functions, and then over time you get way off. It's my job to figure those out and then come up with the best care plan to fix it. I've had multiple head traumas, and so I know exactly what my patients are dealing with. That's why I'm so passionate about it now. I see a lot of auto accident patients. I see a lot of high school athletes with head traumas, concussion. A lot of our other patients are kids that fall. There's not enough people that are fixing it, and head traumas are so much more common than people realize.
I was rear-ended on the freeway headed to work, and so I hit my head really hard on the headrest. And when I came in, I had headaches, light sensitivity, memory loss. I struggled to find my words. I slept terribly. I was sensitive to noise, so no radio in the car. They turned the sound off on the TV. I had a hard time with functional memory. I would lose track of what I was doing, what I was saying. And then when I got here, I started to see improvements immediately. The headaches started to reduce, the light sensitivity reduced, the noise sensitivity improved. Initially, I couldn't keep track of a conversation with more than one person, and so now I can keep track of a group conversation with 3 to 5 people without getting lost. Simple things like, now I know my password.
The normal care plan of just wait it out, rest, just stay in a dark room, it'll get better, isn't really that applicable. So the reason to come here as soon as possible after a head trauma is I deal directly with the brain in every aspect. We look at the digestive system, we look at how the autonomics are working, we look at blood pressures, we look at literally the entire brain. And I've been extensively trained on how to navigate and fix each of those problems that you might have. We're working with 15 to 20 plus concussion patients every day. So I had a patient who was in a car accident about 6 months prior to coming in to see me, but she still had chronic neck pain, she had dizziness, she had headaches, she was anxious, she couldn't focus, she couldn't do anything. And she'd already been through the 3 to 4 months of chiropractic care and the 3 to 4 months of PT. And so when she came in, we ran through our physical exam, we ran through our neurological exam, we did our eye test and our balance test, and we found some things that were off. But within 5 visits, all of her pain was gone, her anxiety was gone, her dizziness was gone, everything was gone, she's back to normal.
Before the accident, I didn't realize how debilitating a concussion can be. Never really appreciated the complexity of the issue. It was actually really disruptive to my career. My industry is already really male dominant. I was terrified that I would have to resign.
As they leave, they don't have these symptoms anymore. They're back to their normal lives. They're back to working, back to playing with their family, doing what they love.
My vocabulary has returned. I didn't realize how much I missed that. Just to be myself again is just such a relief. I don't know where I'd be without him.
I haven't had any other patients say that they found anyone else that can do it like we do. We've made these changes in enough brains by now that people actually just come straight to us. Why? Because we are good at what we do. I find what we need to find and we change it and we improve it and the symptoms go away and the brain gets back to balance. So if you're still dealing with post-concussion syndromes, if you have these symptoms of the headaches, the dizziness and everything like that, there is hope. It's not just a doom and gloom. We can fix it.
If you want to get your life back, this is where you come.